It's 10 weeks since Eve was admitted to Wrexham Maelor Hospital.
Then we'll do a lap with the steps.
She's not certain how she caught coronavirus. Her and husband Chris had been self-isolating, apart from a single visit for a food shop.
Thinking about that nice walking pattern. I've got the oxygen.
When physios Charlotte and Amy first met Eve, she was in an intensive care bed.
Take your time. That's lovely.
The patch on her throat a reminder of the ventilator, which helped keep her alive.
They definitely work better than they worked 6 weeks ago, don't they?
Now they're helping Eve get her life back. Describe what that feeling is like compared to normal times.
It's like being a baby, isn't it? Starting walking again. It's unbelievable, really.
The legs, how do the legs feel?
Like lumps of lead.
So she's got some lung damage, which hopefully in time will get better. But not only that, her muscles in her body have wasted and she's just generally deconditioned, aren't you, Eve? So everything is weak. But it's not just physically, is it? So it's mentally as well.
One day I'm sort of all right, and the next you get lots of flashbacks and things that you've hallucinated on and dreams and all sorts.
What would you say to people who think that the coronavirus is gone away now? They were saying from weeks ago. No, they're being silly. If they've had what I've had, they think twice.
Eve is one of the lucky ones, but Amy and Charlotte have worked with patients who didn't make it.
Charlotte, describe what it was like in there at its worst.
Emotionally draining, physically draining, and in the full PPE, you sweat, obviously you can't drink, talking to other people is difficult through the masks, and to see the patients, what they're going through, I think is hard.
I've asked how Eve is. How are you doing? Not easy.
No. It touches me as well,
You've gone through the journey as much as the patients have. Not physically, but definitely mentally.
Mentally.
Yeah.
By the start of this week, they'd seen 266 patients. The most serious cases, like Eve's, end up here on the critical care unit. After the initial spike, they saw numbers stabilise, but that's changing.
The lockdown has been altered to allow patients to go, people to go back to their normal activities. We've seen those numbers increase slightly.
You're pretty much on the border here with England.
We are.
We know the lockdown in England is a lot less strict than it is in Wales. Is that having an effect, do you think?
Obviously, people in our catchment area who may live one side of the street where the Welsh rules apply, or the other side of the street where the English rules apply, and that is just the nature of living on the border with rules which are slightly different on one side to our side of the border.
Regardless of how somebody got here, Andy has to make critical decisions about their care, and that means being close up to the patient, so he has to wear the full PPE.
First time a COVID patient was actually in there and we were donning to go and see that COVID patient, it was a completely different ballgame. You feel your heart racing. Patients, when they become this critically unwell, become extremely fragile and vulnerable. Only about 20% will need intensive care services, but when they get that sick, when they're that unwell, they're extremely unstable, and we need constant observations of them, constant changing in their management to give them the best chance of getting through this.
How long will you be in there for now?
I spoke to nursing staff on the phone. They're fairly happy that the patients are stable at the moment, albeit very unwell. So I just need to go in there, confirm for myself which way they've been going during the day. As I said, they're very sick. They're on a lot of oxygen and therapy at the moment, and really the next step is whether they need mechanical ventilation. And I'll be making that decision when I'm in there now. So it will take as long as it takes to do that.
Like the rest of the NHS, this hospital had to rethink what it does. The pantomime ward is used to doing hip replacements. Now it's where patients recover from Covid-19. And for experienced nurses like Kath, it's a new way of working.
My background is orthopaedic and surgical, and we've just flipped over to medical and respiratory, and it's a totally different learning curve, but it's you just get on with it, really. It's your job, it's what you do, what we're here for.
These people are putting their life on the line. They've lost colleagues. They are professionals, but they're also husbands and wives, mothers and fathers.
My family was like, do you really need to go to work?
Yeah, they worry.
Is it something you want to put your life at risk?
What was your answer to that?
It's the job, isn't it? Really,
it's the nature of the job, and everyone's like, oh, you're a hero, you're this, you're that,
but
you're so brave. But it's
day,
just
isn't it?
how I've seen it. It's just we've committed with this job, and that's how I've taken it anyway.
Message from you all to everyone at home who thinks this crisis is now on the down and we need to almost move on.
You come into work and you're putting your time and your effort and your health on the line, and you see people off doing whatever they want to do, putting it all over Facebook, Instagram, and you just think, why are we bothering? Why are we bothering going to work? If this is the consequences are going to be dire if people are carrying on doing what they want to do.
Have you thought about how you're going to get back to normal yet?
I think as a hospital it's a conversation that we have all the time, every day, how we're going to get back to normal and what's normal going to be like. I think that's the most important question, isn't it? This could be our normal. To a degree, this could be our normal for quite some time.
Physio done, Eve takes a much needed video call.
We did steps again, and then we did some exercises, and we took her out into the garden.
While she was in intensive care, she missed her 50th wedding anniversary to husband Chris. And when you hear him speak, you realise the victims of coronavirus are not just in hospital.
It's been an absolute hell.
The first 4 weeks were the worst, weren't they, Chris?
Yeah, they were absolute hell. I didn't know what to do. Not knowing what was going to happen to her was just horrible. She's done brilliant. It's a miracle what you guys have done in there. Absolute miracle.
When Amy and Charlotte need a few minutes rest, they head to the staff room. It's now transformed, covered in drawings and paintings of rainbows, made by the children of the staff here. The doctors and nurses, the cleaners and cooks, the porters and physios. Everyone who's helped in this battle. And it's not over.
We've clapped for carers, we've drawn the rainbows, we can hear what you guys have done to save lives. I'm just wondering, going forward, how do you want people to sort of remember this period?
I don't think we've always been that appreciated, so it's just nice now that everybody's got behind us, and hopefully we can just move forwards and carry that love for the NHS on for a long time to come.
People remembering almost like a love affair rediscovered with the NHS.
Yeah, the NHS is here and we want it to stay, and we want people to keep appreciating it for what it is. And the next time there's a crisis, we'll be here to work hard and save lives and look after those again.